Okay, so today, unfortunately, we're going back to class because it's time for an anatomy and physiology lesson on breathing. You don't have to take notes and there won't be a test after this. But I think it's really helpful if you sort of put this information in. If it gets a bit confusing or if it seems like big words, don't worry so much. But I think it starts to really help to understand the back end of breathing so that we can start getting a clearer picture of what breathing is and what it brings to the table and how sort of important it is and how key it is in terms of our posture, our movement, how we show up in the world, how we sound in the world, the quality of our sleep, the quality of our movement, the quality of our breath, the quality of our thoughts. So let's have a little bit of a deep dive into basic anatomy and physiology of breathing. We're just going to go through basically anatomy of breath. So we have this big dome-shaped muscle here called the diaphragm. It's like a big giant jellyfish and it extends from your sternum at the back to sort of lower down below your shoulder blades at the back. What's really sort of important is your psoas actually has fibers that come up and join the crus of the diaphragm. So the crus is two muscles that come down on the side of your diaphragm, and they're slightly asymmetrical. Your liver hangs via a ligament on the one side, and your stomach goes through the diaphragm on the other side, and your stomach kind of hangs on the diaphragm on the other side. Humans are the only mammals that run with a horizontal diaphragm. All other mammals run with a vertical diaphragm. So we kind of have to move our organs along with our breath. So which brings us to the next point is at the bottom of our abdominal cavity is we have a pelvic floor and our abdominal contents are largely liquid. So they're not compressible. So generally speaking, as the diaphragm goes up, our pelvic floor comes up. And as our diaphragm comes down, our pelvic floor goes down. We need space in our pelvic floor for that to happen. Your sit bones need to be wide and we need a resilient and functional pelvic floor that can contract and relax in order to let breath descend all the way up. And remember, your parasympathetic nervous system or your rest and digest nervous system exists in two places in your body. In your neck, with a long vagus nerve, the longest nerve in your body that goes down to your organs, and in your pelvis. The movement of your sacrum and your pelvic floor is intricately linked with the balance of your autonomic nervous systems. Most people understand that your diaphragm helps set up your vagal tone and breathing affects your vagal tone via the diaphragm. But remember, the diaphragm sits on top of the pelvic floor. So healthy pelvic floor really helps up create a deep sort of immersive sense of parasympathetic activation. That's why the ancients called it your base chakra, right? It should be grounded. That's why I'm sitting in the sizer position. So my sit bones are wide. So that when I breathe in, my pelvic floor can descend in between my sit bones and I can get a healthy range and excursion. We also want our pelvic floor to vertically oppose the diaphragm. The pelvic floor and the diaphragm should be lined up. So if you have, let's say, a very tight pelvis that some people like to call it an anterior tilt, your pelvic floor is kind of facing forward and you might have flared ribs and then your diaphragm's facing away from each other. So what we don't want is a pelvic floor that doesn't communicate to your diaphragm. We want it to be stacked so that the two communicate directly with each other. And again, that's why I'm sitting in the sizer position, head on top of shoulders, shoulders on top of hips. My hips are underneath me. And I have access to the sort of relaxed pelvic floor with no tension in my adductor and hamstring muscles going up into my psoas and then into my diaphragm. So that this position is very, very good for working on your breathing because you have such a high functioning breathing system in this position. If I was to sit in lotus, you might find that hamstring and adductor tension, my sit bones narrow, my pelvic floor no longer communicates clearly with my diaphragm. And so we kind of have a bit of a breakdown in that communication in the lotus position for most people. Okay. So inhaling, breathing in. Okay. The diaphragm is the most important muscle of respiration. So when you breathe in, it draws down to make your chest cavity bigger. So as I breathe in, my diaphragm draws down and my pelvic floor obviously relaxes to make space for that diaphragm. But it's that drawing down of your diaphragm that creates the most space in your lungs to suck air in. So that's very, very important that our diaphragm comes down as we breathe in. And in some people, it doesn't occur. So let's say you've been taught to brace your core or engage your core, or even pull your belly button in to activate your core. As you pull your belly button in, your diaphragm will go up. So a lot of people, your diaphragm is stuck up and it doesn't excurse, which is a very good, I'm not sure that's the exact right word, okay? It doesn't move up and down as deeply as it should. So in order for the diaphragm to come down, we want to have a big belly. And in order for us to have a big belly, our lower back must contract. So as we breathe in, okay, so the second most important part of this is your ribs should lift. So as your ribs lift, it makes your chest cavity bigger, so more air can flow in. So this is all inspiration, breathing in. So ribs go up, diaphragm comes down. To make space for diaphragm coming down, relax pelvic floor, wide sit bones, hips underneath you, okay? And your belly needs to get bigger. So you got to relax your belly in order for your belly to expand. So that's why in yoga breathing, they'll talk about belly breathing. Now, you can't only breathe with your belly. So some people will belly breathe, and as their belly gets bigger, their ribs go down. So it's ribs up, belly bigger, diaphragm down. Okay, pelvic floor down. Those are key components. That's what you really want to nail. Then as you breathe out, kind of the opposite happens. Your ribs come down. Now your core can gently engage because it helps sort of squeeze the air out. And your diaphragm goes up and your lungs get smaller and the air goes out. So we want to slow, soft. We want to take fewer breaths per minute. And that means drawing air deeper into our lungs so that we have a slow, big piston that moves a lot of air, a big column of air in and out, rather than short hyperventilation or a diaphragm that's stuck up that'll create tension in our neck. And so a lot of people apical breathe, which is you use their ribs to help breathe, and you'll have very, very tight neck muscles, okay? And your sternocleidomastoid, which are accessory breathing muscles, and your scalenes, which are accessory breathing muscles, will tighten up. We'll talk a little about accessory breathing muscles, but so we want to relax front of your neck, relax shoulder. When your pelvic floor relaxes, your shoulders often drop and just hang there. If your posture is stacked, you can just relax your shoulders. You don't have to pull them back, which often makes your head go forward, or you don't have to cue your posture. It just is. Your spine floats out of this relaxed, supportive base-like pelvis, and then our breath is free. And when our hamstrings and adductors relax, it kind of opens up your chest. So we've done this where you can sit on the floor with your legs out in front of you and try and lift your arms up and realize it's difficult to lift your shoulders, and also your chest will feel constrained. Okay, so this notion of having a posture that frees up breathing, but also that your posture or your breathing, but also that your breathing can signal to whether I am in the correct posture. And again, doing breath work in the sizer position will dramatically improve your posture over time because you're learning to be calm, centered, grounded, and authentic in a relaxed space. But that's the mechanism of breathing. And once you have, so as we breathe in, ribs up, big belly, diaphragm down, pelvic floor relaxing, your lower back will contract a bit. And so you're basically arching your lower back, which is, if you're doing cat-cow, we're now cowing as we breathe in. And as we breathe out, our ribs come down, our core engages, we can round our spine, roll back our pelvis. As your lower stomach contracts, or your transverse abdominis contracts, the famous activation muscle, it'll co-contract with your pelvic floor. So as you breathe out, your transverse abdominis contracts and your pelvic floor gently tightens. But that's okay because your pelvic floor comes up, your abdominal contents comes up as your diaphragm goes up. So your abdominal contents, your pelvic floor, and your stomach wall is basically helping you get the air out. So I like to think of us as a giant bellows breathing out. And when you talk about 360 breathing, all your ribs need to expand. But first and foremost, nail down, diaphragm up, ribs up, big belly, arch your back, breathing out, ribs down, core engages, roll your pelvis back so your spine rounds slightly. So now we're into the cat part of cat-cow. And you can gently tighten your pelvic floor. If you can tighten your pelvic floor, try not to clench your butt muscles or your adductors or your hamstrings, which can be very, very difficult initially. Okay, but that's gently exaggerated, assisted breathing. But that's the pattern that we really want to nail down and focus, because if we have that, the rest will come. How we do breathe is probably more in a circular kind of wave, okay? Rounding as we breathe out and arching as we breathe in will get you 80% of the way there. If you want to open up breathing between your back and your ribs, crocodile breathing, so lying on your stomach and breathing, what happens is the ground will compress your chest and sort of not allow your belly to move. So it's very, very easy to breathe out the side and breathe out the back if you're lying on your stomach with crocodile breathing. But that's basically the physiological or anatomy mechanism of healthy breathing and how it should be. If you have a problem initiating your diaphragm, you can block your nose 50%. So I'm just going to partially block my nose and breathe in. My other hand's on my sternum and I breathe in and I can feel my diaphragm responding. Now, it's really important that you nail down breath in different positions. So just because I can breathe in and my belly expands in this sizer position doesn't mean I can do it on all fours, doesn't mean I can do it on my back, doesn't mean I can do it lying on one side or another side. And if you can't do it in different planes of motion at home, when you're calm and relaxed, it's very unlikely that you're going to breathe well on the bicycle or when you're swimming or when you're running. So we really want to nail our breathing fundamentals in a calm, secure space. Your diaphragm is part of your deep core and it provides stability around your spine. So it's really, really vital that we nail that sort of central stabilizing pattern of the diaphragm. And it also creates pressure and tension through abdominal content in your core. So it's a really important part of bracing during strength training and during movement and providing stability. And also helps with venous return, and it also helps with lymphatic return and your cerebrospinal fluid return, which is basically the fluid that bathes and provides nutrients to your brain. It's really, really important that we have this big, powerful, central sort of wave-like breath that goes through our body for many, many reasons. So it's your immune system, your brain function, your stability, how you show up in the world. Yeah. So as we breathe in, our vagal tone tends to change and we become slightly sympathetic. So as we breathe out, our vagal tone also changes slightly and it's slightly more parasympathetic. So that's why if you want to calm down, we focus on the exhales. And this has got a lot to do with the ease of which blood flows into your heart and out of your heart and the sort of pressure feedback on the heart. But remember, the vagus nerve acts like a brake on your heart. So increasing vagal tone breaks your heart or slows it down and increases your heart rate variability. And when your vagus nerve lets go, your heart rate increases. Okay. We talk about the sort of bracing function of your diaphragm actually initiates and contracts and helps sort of set up this cascade of stabilization. So a muscle that is fully functional has a great range. So having no adhesions, tension, restriction, not living with a sort of tight and guarded diaphragm all the time really, really does help with your deep core strength and with the overall strength and bracing. We talk about Valsalva maneuver. When you sneeze, you start to realize just how powerfully these accessory breathing muscles in your diaphragm can contract. And they have an incredible protective mechanism of your spine. You cannot have a healthy spine without a healthy breath. The correlation of a breathing pattern disorder, which would be like reciprocal breathing. So when you breathe in, your diaphragm goes up rather than down. So let's say you did a lot of core bracing, a lot of planking, and you can just check. So if I take a deep breath in, my belly should let go and expand. And this should happen in all four planes. So if you're lying in bed at night, take a deep breath in, your belly should expand upright. As you breathe in, your belly should expand. And if it's not, if it goes in when you take a deep breath in, that's reciprocal breathing. And there's an 85% correlation between reciprocal breathing, which tends to happen when you're in a state of fright or anxiety or tension, and back pain. And then one other thing is also we talk about the sort of the ventral part, the front part of our vagus nerve being mammalian. The tone of your voice powerfully affects your vagus nerve. That's why, so humans have co-regulation. We will make faces or make baby noises. We have a stern tone or a laughing tone or forgiving tone or compassionate tone. We're extraordinarily sensitive to tone. And having a healthy breathing system profoundly affects your tone and the way you speak to others and therefore the way they receive you. So it really, really does open the door to co-regulation with other mammals. And co-regulation with other mammals, other humans, including animals like your dogs or your cats or horses or whatever, is one of the ways that we have a healthy autonomic nervous system. It's vital that we get along with other mammals. So a muscle that we touched on was the psoas muscle. So a psoas muscle is a tonic muscle. You have two categories of muscles. One of the ways of categorizing muscles is to say we have a tonic muscle and a phasic muscle. And the psoas happens to be a tonic muscles, as are many of our postural muscles, because they hold tone to hold our posture. When tonic muscles become dysfunctional, they're normally slow twitch because they've got to hold your posture for a long period of time. So they're primarily endurance muscles, not quick reacting muscles. Now your psoas, when it becomes dysfunctional, will increase its tone, hypertonic, so too tight, and it tends to become reactive. Phasic muscles like your glutes or movement muscles, when they become dysfunctional, they tend to become weak and inhibited. And that's one of the reasons we really want a big, soft range in our breath, because it implies a big, soft range in our psoas, which also implies that your psoas and your iliacus won't inhibit your glute function, okay? But having a healthy and relaxed psoas is really, really important for your autonomic nervous system. And there's many sort of areas that you can deep dive into this. It's a whole topic of a conversation itself, but your psoas is kind of like the seat of your soul, or the muscle that you're probably likely to store almost the most amount of trauma, emotional trauma in. So having a soft, relaxed psoas will really decompress your back, really help with hip function, and breath is the pathway to healthy psoas and then also healthy hip function. So that's why we're always linking breath to hip function, always linking breath to our psoas and iliacus function. Now, a couple of other notes. If our breathing is dysfunctional, our accessory breathing muscles tend to overwork, and there's a lot of accessory breathing muscles. And there are a lot of accessory breathing muscles. So we talk about the SCM, which also helps sort of turn my head from side to side. Your scalenes, which are vital because your brachial plexus comes through your scalene. So often if our scalenes are tight, it can tighten up on our phrenic nerve, which is the nerve to your diaphragm, the other nerve to your diaphragm, and it can affect our breathing. The coracobrachialis, the serratus anterior, which is the muscle sort of underneath your ribs here, and we'll do some mobilization of your scapula and serratus anterior, but your serratus anterior goes right up into your first rib at the top of your shoulder. And it's often linked to problems like thoracic outlet, where our outlet to our thoracic spine into our hands becomes so clamped that it clamps the vein, artery, and or nerve and lymphatics. And it can often cause real problems to settle that down. And that's tight accessory breathing muscles. And the other one is your pec. The pec minor is an accessory breathing muscle, and it goes from the top of your shoulders down to the top, I think 3 or 4 ribs. It basically goes from the point of your shoulder towards your nipple. And that lifts your ribs. So if you're apical breathing or breathing hard, your pec minor helps try and lift the ribs to help your breathing. So imagine if you've got paradoxical breathing and your diaphragm is working against your pec minor, they're going to be constantly strained or overworked. And when your pec minor is tight, it tends to roll your shoulders around. Now, when your shoulders are rolled around, it'll signal to your hips to roll around. And you can see, okay, so there's either you're on the right side of this breathing curve or you can get on the wrong side of this breathing curve. So let's just do 2 exercises and then the other big accessory breathing muscle, and there are more, is your transverse abdominis, which is engaged as we exhale and then relaxes as we inhale. Remember, a healthy muscle has function and range. So contracting and relaxing a muscle is what makes it healthy, not walking around with a chronically tight toned muscle, which actually paradoxically makes it weak and not functional. And then the other one is your QLs. So as we breathe in gently, your QLs, which is these muscles in your lower back, sort of tighten. And as you breathe out, they let go. And obviously in gait, the one QL is hiking your hip up and helping you with movement, which is part of your fundamental crawling pattern. And that leads us into a serratus anterior, which is an accessory breathing muscle as well. And you have a serratus posterior. Between your shoulder blades is really important because your rhomboids and your serratus posterior is kind of the synergist muscle with your psoas. So you can be very tight between your shoulder blades if you have a tight psoas muscle. Tight shoulder blades are also linked to your startle reflex or threat response. A lot of people are told to pull your shoulders back. It's a really bad idea. Pulling your shoulders back will pull your head forward. But more importantly, it activates a sense of sort of threat or startle or getting a fright. And it can lock that pattern in and it affects your psoas muscle. So to have a relaxed shoulder and a relaxed psoas implies that you have relaxed shoulders and between your shoulder blades. So on our community here, we do a lot of work of opening up between our shoulders. But if I'm in this position, and you can do it standing as well, a happy hip hack, as I lift my shoulder blade and breathe in, and I want my knee to go forward, I'm kind of mobilizing my serratus anterior and getting my shoulder blade to glide on my back. So happy hip hack is primarily a shoulder to hip, and it's the separation of distance between your shoulder and hip. So breathing in, breathing out. And we do that as recovery in our resilience breathing because it's so good for our accessory breathing muscles. So breathing in, okay, my shoulder moves away from my hip, my shoulder blades gliding on my back. My QL is lengthened on this side and shortened this side. My rib cage is going this way. My belly is soft. My diaphragm is down. My pelvic floor is relaxed. And my ribs are lifting. And then breathing out and adding that to our resilience breathing. Once you've got the hang of it, you kind of don't really have to mobilize your shoulder blades as much. Is a really good way of teaching your body relationships and trust between these accessory muscles. And your serratus anterior, instead of being locked and holding on and clamping down on your rib, starts to realize, oh, I can work with my breath. Really, really good for your swimming and for your overall shoulder health. A lot of people that have frozen shoulders, I keep telling them it's related to anxiety and fear and sort of tension, or maybe the startle. And you start to realize, oh, I can just totally create a shoulder to hip connection and breathe my way out of frozen shoulders. Now, the other one is your pec minor, and rotating your neck and creating space in your serratus anterior and your scalenes and your pec minor is a really good idea. So pec minor is if I sort of open my chest and yawn like I'm in a open my chest and yawn as if I'm in a mattress commercial. I just woke up from one hand on your back, breathing in, opening your chest. And as I open my chest, as a result, my neck rotates to one side, breathing out, breathing in, and I'm sort of flaring my elbows a little bit and creating space between here. That really helps your pec minor lift your ribs as you breathe in and create length, and then breathing out sort of shorten. And that's also why we do cat-cow with rounded shoulders as we breathe out and elbows forward as we breathe in to create range and function through our pec minor muscles. So some of the movements and stuff that we do is pretty simple, but there's quite a lot of depth and complexity to it. But always we're trying to get the synergy, these muscles working together so that we have this big breath that just travels throughout our whole body. And we have multiple joint segments and multiple fascia and muscle connections all talking to each other. Okay. So we covered a lot, but it helps explain the contents of probably you'll enjoy your next breathing class a bit more, your Monday mobility, and say, oh, that's why we do it that way. Let's just go through some take-home strategies so we can sort of condense down this big, long podcast, basically. Okay. So I think the most important thing is every day try and reset your breathing pattern, especially if it's dysfunctional. So the first thing when you wake up is breathe in and round, and then breathe in and arch, and breathe out and round. And you can do this in your bed and just get that going. Often our breath runs away with us at night. And we can end up with a reciprocal breath pattern, especially if you lie on your back, your sort of ribs flare and your stomach comes in and suddenly your diaphragm's stuck up in the morning when you wake up. So restore your breathing pattern first thing in the morning and make sure that you nose breathe when you sleep at night. Your mouth must be moist. You have to nose breathe when you sleep at night. Otherwise, it's very difficult to correct your breathing patterns. Okay. Soft, slow spinal movements. Breathe with your psoas and contract and relax that psoas, and make sure that you understand that your psoas is vitally linked to your gait patterns. So we don't do 90-degree knee movements. We do soft and float the knee forward, because that way we use our psoas and hip flexor muscles softly is the gateway to activating your gluteal function. Okay. You can monitor your accessory breathing muscles, your pec minor, your serratus, your QLs, your psoas, and if those muscles are tight, you probably find you're not breathing as optimally as you should. So double down on your breath function. As your breathing opens up, so too should the tension in those accessory breathing muscles. Okay. 365 breathing. So 3 times a day, slow your breathing down to at least 6 breaths per minute and do that for 5 minutes. So my preferred way of doing that is just to hum, because if I breathe in through my nose and hum, you will automatically slow your breathing down to at least 5 or 6 breaths per minute or even less. Okay. You can gently pinch your nose every now and again and breathe in and make sure your diaphragm's initiating your breath, and make sure again, think about your pelvic floor. Sometimes you can just tighten up your pelvic floor muscles as though you were sort of stopping a urine in midstream. Hold it there for 2 or 3 seconds and just let it go. And as you let go, it'll really, really help relax your shoulders and help with your breath. And the other one is relaxing your jaw. So the important part of this is tongue posture, which we've discussed before. So lips closed, big fat tongue pressing up on your palate, and your teeth either gently touching or lightly apart. When your jaw relaxes, it signals to your pelvic floor to relax. It'll really relax and help slow your breath. Okay, so that's quite a lot. But I think it's well worth understanding that there is a deeper layer. You can come back and watch this again, because I promise you, you'll always start, as you begin on the path, you start to understand these concepts deeper and deeper, and you start to realize how powerful and important they are. And when you nail it, how everything starts to fall into place for you. Or if you're working in against the system, how basically hard life and movement and your mental and emotional state can be. So it's pretty complex, but it's also really, really simple. Breathe in and arch, breathe out and round, move with your hips, move with your breath. You totally got this. Don't get anxious about your breathing. Don't judge yourself. Wherever you're at is fine, because I think the most amazing thing about exploring your body and opening up is the fact that this journey is really enjoyable as your body sort of opens up and lets go. And that is the thing, not some end goal. Like, don't wish you were somewhere. Enjoy where you are and enjoy the journey to getting to somewhere. It's the journey that's important, not the destination. So join us tomorrow, and we are going to discuss, what are we discussing tomorrow? And so now that we have a bit of the fundamentals of anatomy and physiology and sort of function of our breathing system, what we'll do is we'll dive into respiration rates and using your breath as gears, or trying to attach your training zone and intensities to different breathing rates. Thank you for listening.